Well, let me ask you this because these are two really important questions. For me, if I'm in pain, stick me with needles, run me through machines, that doesn't bother me. But for the person that's watching, is like, Doc, I really sound interested in this, but we're talking about my neck.
Mhm.
How intrusive is this? How scary does this look to me? I seen the video, so obviously I know the answer. Can you kind of walk people through what they could expect if they came to saw
Yeah.
you?
Yeah. So from the very beginning, we don't take any patients unless we know we can help them. We've had experience in helping them clinically in they're the symptoms that they have, but we also have an entire the first day they come in, there's no adjustment. I want to make sure they're a candidate for what we do, make sure it's in my scope. I don't treat diseases. I don't treat any of these things necessarily. What I do is I make sure that do they have a misalignment at the atlas? So if they do, if there's a mechanical issue, I can help that. Now, that mechanical issue can cause all these other issues. So what I need to see first is, do they have the atlas misalignment? If they do, can I help them? Or is there anything that is contraindicating, getting care? So we do a battery of tests to make sure that they are exactly where they need to be. There's nothing contraindicating that. And then the following day, they come back, and that's when we do the full report. So they'll get a complete understanding as to their why. I mean, how many times have you gone to the doctor and the doctor says, here, just take this? And you say, doctor, why? Well, I don't know. It's this. Well, nobody has a headache because you have lack of aspirin in your bloodstream. Okay. There's a functional reason why you have that headache, and we're there to tell patients why. That's the big thing here. Patients don't know why. They just know they've been told to take this or get this surgery, and that's it. But we tell the why. Then that's the day two that we do that first atlas alignment. Now, if you go to drjentaylor.com, you can actually see that from the beginning to the end. That is a first atlas alignment. And it really is a very simple tap behind the ear. It can be on the right side, it can be on the left side, depending on what we find on your very specific films that we take to get those vectors. It's a vector-based adjustment. So you'll notice on that video that I measured everything out. There's even a dial on the instrument that I have one last angle. People really get up from that and they go, that's it. They're like, yeah, that's it. It's really that simple. It's so simple, it's hard to understand. But we walk patients through each step because most people have never heard of this, just like yourself. And many of the listeners right now, they've never heard of something like this before. But really, this is the gateway from the brain to your rest of the body. And if that gate is locked up, so is your life force. I mean, that sounds kind of grand, but it really is. This acts as a choke point, if you will. And for me, I see the results in myself. I see the results in my children. I mean, my children have been adjusted since they were 7 hours old, respectively. I make sure I could get up and do things, but I adjusted them both the day they were born. And they've held their atlas for years now. They've never been on antibiotics ever in their life. They've never had a prescription drug, and they're both teenagers. Not many parents can say that, unfortunately. You
And,
know?
and that's so powerful.